Well, this Friday, we are going to begin at the CDC, where we could learn what health officials plan to do about the Johnson & Johnson vaccine as early as today. A team of outside experts are expected to meet and offer their recommendations on a next course of action after the shot was suspended due to reports of very rare but dangerous blood clots. Laura Podesta is in New York with the latest on this. Laura, what do we know so far? What can you tell us?
Good morning, Anne-Marie. Well, a few things could happen in today's meeting. The CDC's advisory committee could recommend stopping the Johnson & Johnson vaccine entirely, or resuming it completely, or resuming it for just a specific portion of the population that is less at risk. Or they could decide to extend the pause. Whatever happens, the president and officials say that the Johnson & Johnson vaccine will not have an impact on the overall vaccine effort in the U.S.
A federal advisory committee may lift the pause on the Johnson & Johnson vaccine today. It comes more than a week after distribution was halted, following reports of rare but dangerous blood clots in fewer than a dozen people.
Over 6 million doses. The number of these reported blood clots was still, exceedingly rare.
The FDA will likely now require a warning with the shot.
I think too many people may be scared off by taking the vaccine. They shouldn't be, but perception is everything when it comes to vaccines.
Officials are also investigating the death of an Oregon woman who developed a clot, though it's still unclear if it was related.
It might be about a week or later before they're able to conclusively decide on the cause of death.
Bringing the Johnson & Johnson vaccine back into circulation would mean an additional 10 million doses. But around the country, vaccine appointments are increasingly going unfilled.
We are not seeing patients that have been vaccinated being admitted to the hospital.
Younger people are making up the majority of COVID patients at Goshen Hospital in Indiana.
Infections are going up, hospitalizations are going up, and both of those things are unnecessary.
Abby Hall got COVID in December and is still dealing with health issues.
If something health-related pops up in my life, I'm always like, is this new or is this COVID-related?
Researchers at Yale University recently launched a study looking into whether the vaccine may actually help alleviate the lingering symptoms in some so-called COVID long haulers.
More than 135 million Americans, or roughly 40% of the population, Anne-Marie, have already received one shot.
You can count me in that portion. Just got my shot last week. So if the pause is lifted today, if the pause on the Johnson & Johnson vaccine, though, is lifted today, then, when does distribution start? Can they just sort of is the machinery sort of ready to go and we'll start to see the J&J vaccine in areas across the country?
We are hearing that distribution would start back up almost immediately, likely by tomorrow. But there may be some vaccine hesitancy around the Johnson & Johnson vaccine, as you heard in my report earlier. So we're not expecting appointments to completely fill up. And part of that is because there are a lot of appointments that are going unfilled already with the Moderna and the Pfizer vaccine available nearly everywhere. So clearly supply is outpacing demand at this time, Anne-Marie.
All right, Laura Podesta, thank you.